the people who make the test for the EPPP reached out to me to take the part 2. I wish it was called something different, but I think that this helps them justify having another exam. But they reached out to me because I recently took and passed the EPPP, and they need to beta test it. And so they are complete in the items that they have, like they have the final version, but they want to do their final version. And I think they have to figure out like the norms for the test. And so the people who recently took EPPP are good markers for it, which means I don't have the results to my exam, and I will not have the results until after they are finished beta testing, analyze the data, decide which items didn't perform well, and then have a final score. So that's not gonna happen until mid-June, like June 15th or something. So if you come back around that time, I will have a video where I say whether I passed or failed. Was it hard? It didn't feel hard to me. I'm a good test taker, so they have sample questions that I'll put up in a second. But they have sample questions that I took. I looked at them and did fairly well on them, but there were only like five sample questions. And overall, the test felt okay. Like there wasn't. It's not as tricky as the part 1 EPPP. The questions are not confusing. It seemed really easy to do process of elimination. A lot of the multiple choice questions only have 3 options, and so you just have to pick one, but then they have another 5 or 7 multiple choice where you have to pick like 2 options. But still, it felt very much like not common sense, like clinical training. Like good clinical training would prepare you to answer these questions. If you have, reviewed the ethic, you have reviewed, ethics over and over again. So if you know that well, if you you would know. At this point, you would know. So I would expect that a lot of people probably wouldn't perform poorly on this exam because it doesn't feel like a test of test-taking ability. It feels like, do you know or do you not know? Like do you know common practices for psychologists or not, is what it felt like. So I have some notes. Let me go over just a couple things before I get into like the example questions and stuff. The time limit is similar to the part 1, 4 hours and 15 minutes. I finished in about 2.5 hours. It's 170 questions, which is less than the 225 that the part 1 has, but I think there's so many moving parts to this exam that you're probably going to use the same amount of time on the part 1 as you do on the part 2. And then the cost. So they are, because they're beta testing it, they gave a discounted fee. So the exam costs $300 plus the $87.50 that Pearson charges for you to sit and use their computers. So when you take this exam, it's gonna be like $400. For me, it was $100. They're beta testing with this $87.50 to sit in Pearson's room. So I wish there wasn't this added hurdle, added expense to getting licensed. This is what they're doing. Everything just costs money. So those are like was it hard? I told you that. How to study for it? I think the way you study for this is how you prepare for the part 1. I don't think there's anything extra that needs to be done besides, hopefully there are more people who give study guides on the content and the style of the questions. And while I think they are very straightforward, I think it would help if there were more resources on the question style and how to answer that particular question, because I couldn't find anything. I don't think anyone has had time or access to these items to create a study guide on them, to create example questions, because it's not out yet and people are just now starting to take it. So the exam has different sections, less sections, or maybe they've combined sections, less sections than the part 1. So there's not like a bunch of research, there's not like a bunch of percentages, nothing like that. You go over scientific orientation, and I can't even think of a question that they had for scientific orientation. It's only 6% of the questions. Assessment and intervention, 33%. when I saw this, I on the exam, because I looked at this and I'm like, I can't really imagine what the questions are like. But when I got in the exam, I was like, there are a lot of assessment questions. There are a lot of assessment questions, and I am child concentration, and part of that is assessments. Like, you need to be able to assess, patients well. So there are a lot of questions on testing. It's not test construction questions. It's really about diagnosis and intervention questions for assessments. But I'm just thinking of someone who did their internship at a counseling center or at a hospital, and I'm wondering how many full battery assessments have you done? And in my internship and postdoc year, I did so many. I did about 50 assessments in my internship year. I think the average is like 6 to 12 that's done. And before that, I had a lot of testing practicums. And then my postdoc year, I only did testing. And so I did 150, something like that. It's just an insane amount of reports. But that also means I have an insane amount of exposure to assessment. And so these questions are like second nature to me. One of their questions was about what happens all the time in private practice or in any assessment of a child that's presenting with ADHD. ADHD is very, very common, right? How do you tease apart ADHD and anxiety? That's like, you should know this. Anyone who's doing testing, like at this point of getting licensed, you should know this. And so they're testing you on that. And so the questions didn't seem hard, but I imagined if I didn't have so much testing experience, this would probably be a very difficult question for me to answer. Like, how do you know is it anxiety? Is it ADHD? Is it both? Like, is it something else? You know what I mean? So there's a lot of assessment. I mean, that's the biggest percentage here, 33%. And then they have relational competence, and then professionalism and collaboration, consultation, and supervision. Right? Those are like similar percentage, 16%, 11%, 17%. But I felt like, they all felt really similar in question style. I don't know. Maybe I just couldn't tell what belonged to which section. They're asking about like dual relationships, like in ethics, and what do you do when you're not particularly trained in a topic, and the importance of consultation. It all felt really like we've been told this over and over again. If you know the ethics code, like you understand it's important to collaborate with people. They did have some like IO questions on there. There was like a question about coaching that I didn't know how to answer. But I'm not in that field, and luckily they're not giving a lot of questions that are like that. So that's like their breakdown of the different sections. It felt very straightforward. I think the only interesting thing about this exam is they have a different format style. Yeah. So 45% of questions are multiple choice, and I told you like some is just you choose one, some you choose two, and then they have a ton of strategy scenarios. So like real life case presentations, I suppose, where they just give you a snippet of what's going on in their life. But then that one scenario has like a lot of different parts and sections. And the thing about that is you cannot go back. Like you cannot change your answer from the beginning, because then they're giving you more information about the scenario. And so you get a more cohesive understanding of what's going on, but you can't go back and change your answer. That's so not real life though, right? Like if you had like a working diagnosis in real life and you saw the person for counseling later or a second testing session or whatever, and you gained more information, you would change, right? Wouldn't you just change? You would change it. You would say, oh, well, I'm not, that was my working diagnosis, but I'm going to change it to this. It's not like you gathered all this data and then, because I mean, even in real life, right? In real life, you may have completed a report and then gotten more information afterward that changes the diagnosis. Like happens in real life. So I don't know why they wouldn't allow you to go back. If I have more information to make a better, decision on the diagnosis, why can't I go back? But you can go back. And so for half the exam, you cannot go back and change your answer from question to question. You have to just use whatever little piece of information they give you, which is enough to get a sense of what they're asking. Because of how much I studied the way the part one of the EPPP was constructed and what is exactly are they asking me. That's one of my strategies for taking the exam. Here is the question. Is this like a dual relationship question? Is this a diagnosis question? What are they ask? What are they trying to get me to focus on in this question? Which topic does this fall under, so that I can figure out like how to best answer this question? But a lot of the answers and the options seem like really like straightforward. So there was this one scenario with the guy, and I have the links in the description box so you can go look at the sample questions that they have. But they had this one sample question about this guy who his parents don't like his girlfriend, and they're telling him that he needs to break up with them, and what should the psychologist focus on? And that one, was that really obvious to me? I'm not sure, but it's really about, you have to make sure you're as competent as possible before you can help another person, right? Like, you can only take a client as far as you have gone. And so if you don't understand your limitations, then you're not going to be as effective. And so there were a lot of questions about, do you understand your competence level? Do you know what to do when you are not fully competent? Like, if you are engaging in practice that you did not do in your internship, in your postdoc, that's not your scope of, what do you do? What are you supposed to do? And I think it's really clear. Like, they tell you what you're supposed to do. Like, you're supposed to consult, you're supposed to go to trainings, you're supposed to like re-educate yourself, get supervision if you need to. Like, those are the things you have to do. And so it seemed like pretty clear, obvious to me. I forget the other question. I have it up. There's another question. But the multiple choice questions seemed really straightforward to me. The scenario questions seem like, kind of obvious, but I'm not sure. And then I think maybe the scientific orientation ones are ones that I wasn't the most sure of. I think I passed. I think so. There were a lot of questions where I was like, yeah, this is it. Yeah, this is it. Yeah, this is it. And I can think of like a handful of questions where I was like, I have no idea. But that wasn't a lot of questions. And it just, the answers seemed so obvious that I was just, I'm fairly sure I passed. But when you come back in June, I'll let you know, because they are allowing me to retake it if I fail, for free. I think maybe I do have to pay the sitting fee. I don't remember. But I'm also going to show you the links, description box, the emails, the whatever. I don't have a recommendation on how to study more than just what you've been doing for the EPPP. Like, if you go over all those different sections, if you go over the ethical code with a fine-tooth comb, I think it will really help you. If you reframe it from scariest test ever and so anxious to not being afraid and seeing how high you can pass. I also don't know the scoring of this exam, and I don't know what the pass cutoff score is or anything like that. Like, my objective was get as many correct as possible, because it's a new exam and they are still figuring out stuff. So let me know if you have any questions. I'll try to answer them to the best of my ability. It's just coming out. It's just coming out. And so, give yourself grace if you're having to take this. And, hopefully there will be lots of study materials that come out soon. Let me know what you think in the comments, and thank you for watching.